For this particular live, it's going to be centered around facial feminization surgery, so FFS. This is a surgery that trans women, non-binary leaning femme type people will get if they want to feminize their face. I'm not saying everybody does it, and I'm not saying everybody has to. But this is something that I feel like I need to do. I've been looking at it for years now. I don't know, give or take a decade. No,
Something.
no,
Yeah.
no.
I mean, if you, I imagine anybody who is going through the process of transitioning in any way does a prodigious amount of research. Like, I feel like for you, especially when it comes to like medical transition, it's like vetting so many different surgeons and trying to get as perfect of a fit as you possibly can within the parameters that you have set, both financially, with insurance, if you have to use insurance. It's a it's a really intensive research process, and she has done so much work trying to find a surgeon and to vet them out. Um, I mean, how many appointments did you actually
How many
like?
consults?
Yeah, consultations. Yeah.
So I had 4 consults
Yeah.
and could have had like 5 or 6 more,
Right.
but the way it worked out is that actually 2 years ago we started out with Dr. Well, I don't want to say any doctors' names yet, so let's just say we started the serious process 2 years ago of consultations, and this may have been between 3 and 2 years ago of
Mhm.
consultations, um, and then trying to get the money together, seeing if insurance would cover it. Insurance wouldn't cover it back then. Insurance covers it now. Insurance covered it last year, but we didn't have the money last year. So
Couldn't
we
make it happen.
we couldn't make it happen. So we just had to cancel. This year, the same thing, but for a different reason. We thought we were going to have to cancel this um, because the hospital that I was going to have it just didn't have enough room. And I needed to get this done by the end of this year because I had met my out of pocket maximum. And that, of course, makes it cheaper.
Yeah.
And, what trans woman does not like cheaper trans women? So, and anybody, people just don't want to pay thousands and thousands of dollars if they can help it.
Partners like it too, but
Partners like it too. Understood. Understood. Yeah. So yeah. So anyway, the surgery was slated to not happen before 2025 ended, and it would have been an additional close to $4,000. So we had both decided that you know what, no, we're gonna just wait and we will concentrate on saving money for something else. Um, while I was in voice therapy, uh, I got an email from my surgeon's team saying, congratulations, your surgery date is December 11th. Here's some of the information. What is it? What's the name of it? Where are we going on November 24th?
oh, the pre-op.
The pre-op is November 24th, and then the surgery is December 11th. So things are happening kind of quickly. Um, uh, and to be honest, I haven't really been, I started preparing and then I stopped. I'm not as ready as I want to be. So I'm going to give it a hard push starting on the night. I'm sorry, on the 11th. So that'll give me
November.
one,
Yeah.
yeah, the 11th of November.
I'm 1 month out.
It'll give me 1
Tuesday.
month. Yeah, Tuesday.
Okay.
Yeah, it'll give me 1 month out. I'm really gonna try and do the exercise, the walking. I'm gonna try and yeah, all the good stuff.
We're gonna do this.
We're gonna do this. Okay. So with that in mind, this is going to turn into a podcast in which I'm going to do a weekly update of the journey and what I feel is going on. Um, it's also going to be breaking down some of the surgeries because FFS is not just one procedure. It is a series of procedures. And you can pick and choose along with your surgeon as to what you may need. I am getting how many? Let's see. Let's count this down.
1, 2, 3, 4, 5, 6, 7, 8 total.
8 total procedures today. So not today. I'm sorry. 8 total procedures. 8 total procedures on December 11th at 8:30 at 8 in the morning. Is it 8?
Well, I don't think they've said the exact start time in terms of when we have to be there, but
No, they said we have to be there at 8.
I thought that's when the surgery was.
Oh, surgery starts at 8. Egg is right again. Surgery starts at 8.
So that means we'll likely have to be there 2 hours ahead of that. So
right.
About 6. Whew.
6 o'clock in the morning. And
Eggy salad's not going to like that.
Eggy salad won't like that.
But that's all right.
I will not like that. Onyx Rose is not going to like that. I'm telling you a true thing, but we'll just we're going to deal. So like I said, this is going to be turned into a podcast of sorts. So I can.
We're real loosey goosey.
Yeah, we're real loosey goosey here. It's going to be all about FFS though. This particular podcast. Today, I think we're going to go over some of the things that I've been approved for in terms of procedures. Like we mentioned, there will be 8 of them. So now, in doing my prodigious research last night, I came up with the understanding that I don't understand a lot of what this shit means. And that's a problem. So I will get clarification and a lot more clarification. You know what I'm saying? So let's go ahead without further ado and start with
go from the top to the bottom.
Let's start with the top to the bottom. Like, do you have your phone?
Yeah, I have my phone.
Do you want me to use it?
It's up to you.
Okay, let me use this.
Are you gonna be able to read that or the phone easier?
Wait, you're writing?
Well, either that or
I'll read the CPT codes.
Okay,
yeah,
go for it.
Okay, so wait, should we read the CPT codes?
You said you were going to.
Okay, y'all. I don't know if this is what we're supposed to do. Like,
well, I mean, if the CPT codes are shared with the patient, I mean, it's part of your record. So if you want to share it, you can share it.
That's true. Okay. So we're going to go down this list, yo.
That's my opinion anyway.
And I'm sticking to it. Okay. So CPT code, Ed, get your phone out, whip it up.
Okay. I'm getting the internet.
So this is my approval letter right here from insurance that says, yes, you have been approved for these procedures, FFS. Yes. Like I said, it will be December 11th. The surgery starts at 8 o'clock. So if anybody lights any candles or prays, like I don't believe in that, but if you do, that's cool. Any kind of well wishes, that would be great, because this is a 12 to 14-hour surgery likely. And I haven't been under for that long in a minute. And I don't think I've been under that long ever. So yeah. Okay. So here we go. CPT codes.
Number 1.
Okay. First one is CPT code 15828. Mm-hmm. Rhidectomy, cheek, chin, and neck.
Yep. So this surgical procedure involves tightening and removing excess skin from the lower face and neck. The purpose is to tighten and reshape the skin and underlying tissues of the cheek, chin, and neck. So it can remove excess skin, repositioning tissue, and closing incisions as part of it as well. It's distinct from other rhidectomy codes, which are specifically for the neck with platysmal tightening Wow, that's a lot of
What is platysmal typing? Well, we don't need to know that.
platysmal.
Platysmal typing. That is not something we need to know right now, but I don't think that's something that I need to worry about, is it?
I think the other code is specifically for
Okay.
tightening.
Okay.
Your code is not related to that.
Okay. So basically, this is a fake and a face and neck lift.
Yeah.
Facelift.
So,
Fleeky deaky. So
like right, like in here.
Yeah, all these jowls that you see right here. The jowls, the double chin or triple chin,
and also the neck here too.
The neck, yeah.
Some tightening in here.
So I will get tightening. I'm hoping that I don't look too plastic. Not gonna lie.
Well, you will at first because there'll be a lot of swelling, but
right, yeah. First, okay. Let's go on.
Breathe, babe, breathe.
Let's go on.
Next code. Hold on.
Next code.
Go ahead.
CPT code 40799.
40799. All right. So this code comes up as an unlisted procedure for the lips, but let me see if it. It says it's used for a wide range of conditions, including congenital deformities, injuries, tumors, and cosmetic concerns. So in Onyx Rose's case, it's basically to lift the lip and shorten the distance between the bottom of her nose and the top of their lip. So it's just to shorten that distance because maybe you can explain it better why.
Well, it's considered more feminine to have a shorter philtrum, and that's what that's called, the distance between the bottom of the nose to the top of the lip, that little dip. Right. That's the philtrum. And the shorter distance is considered more feminine. The longer distance is considered more masculine.
Okay.
So in order to have symmetry on the face, often a lip lift is done. And also it brings the lip up a little bit so it shows the teeth a little bit more and the upper teeth. And this is also considered more feminine.
Cool.
Okay.
What we got next?
So next. Uh-oh.
I hit the wrong button.
Oh no.
Panic ensues.
Panic ensues. Oh no.
All right, what's the next one?
Okay. So next one is 1401.
Wait, 140.
14041. Yeah.
I was gonna say that's not enough digits.
Right. Yeah.
All right, go ahead.
Okay, so this is ADJT. So adjunct adjacent rear GMT.
So the way it reads on the
paper,
it's like alphabet soup. So
it really is. It's a mess.
It's like impossible to know what it means just by reading it off the page. So I'm gonna tell you what Google says. Okay.
Google flu.
So basically, it's an adjacent tissue transfer or rearrangement on the forehead, cheeks, chin, mouth, neck, axillae, hands and or feet. It can also pertain to genitalia. Obviously not the case here. To repair a defect measuring 10.1 to 30.0 square centimeters. So basically it's a tissue transfer. But for Onyx Rose, it's going to be something and related to tissue transfers around the face. Specifically. So it can be cheeks, it can be neck, it can be mouth, it can be forehead.
Wait, is this
this we think this is one of the CBT codes that we have additional questions for our surgeon.
Because I went in thinking I knew all of these, but I don't know.
But now that we're talking through it, it's just like, I don't remember.
Is this the buccal fold?
I don't. It's possible it could be related to the buccal fat, or it could also be related to the sliding genioplasty.
Oh, right.
Which is a separate code that we'll talk about at the end. Well, toward the end. That's towards the bottom of the list. But it could be related to that, but it's just basically taking tissues from one area of the face and either transferring it to another area of the face to help support some of the work they're going to be doing in those areas, or I mean, that's pretty much what I'm getting from it.
Right. I am
Stay
not.
tuned. We'll tell you more.
Yeah, I'm not 100 on that. So once we get more information on that, we'll let you know. Let's move on.
Okay.
Shall we? I am going to get a drink of water myself. I'm feeling parched. My throat is parched. Ooh. Okay. Next. CPT code 30420.
Okay. What does it say on the paper?
Rhinoplasty primary with major septal repair.
Cool. This may already have clues that you may already know, but
Very much
primary
clues.
rhinoplasty that includes a major septal repair. Wow, why can't I say that word? Which is a surgical procedure to reshape the nose and correct a significant deviation of the nasal septum.
So this is what needs to happen because I like my nose except for this part right here. I want it shaved down a bit. I don't want it sunk in. And I'd like the tip of my nose moved up a little bit, a little bit. So it pushes,
tips up just a tiny
tips up a tiny bit instead of hangs over. Yeah. That is also more of a masculine trait. So
let me ask you,
yes.
Are you looking for like a slight narrowing in the bridge?
Yeah.
Or are you looking
a slight look at yours? That's exactly what I want.
Okay.
Yeah. Because yours does not have this bump.
Oh, I see what you're saying. Okay.
No.
Okay. I see what you're saying.
Now, I don't know how this is going to do in terms of me and my glasses, but
well, I mean, it may be that you'll have to get a different style of glass that has different kinds of like nose bridge.
Right.
That helps to keep in place better.
Right.
Possibly.
Okay.
You might not. You might
they might stay on. Well, no, they don't stay on now, so they're going to just slip even faster. But yes, so rhinoplasty just going to fix the nose a bit. Yeah. So let's go on to the next one because I don't want to say too much right now.
Okay. Hold on a second.
Yeah.
All right. What's the next one?
Okay. Next one is CPT 21139.
Okay.
And that is reduction forehead.
Yeah, so forehead reduction procedure that includes contouring and a setback of the anterior frontal sinus wall.
This is what some people would have type 3 forehead reconstruction. I am not having type 3 or type 1. Maybe this is, I don't know what it is. It sounds different than what would be considered type 3, but
right.
Did he say when we talked to him that it was considered like one of those, like 1, 2, or 3? Or if this was his
I don't recall him saying
a
particular level, but there's a particular. So what happened was Onyx Rose had to get, was it a CT scan? Was that it?
Yeah.
Okay. So they had to get a CT scan, and that CT scan, we actually got to see at least some of the images from it. It was really, really fascinating to see. It is,
yeah, super fascinating.
And so the surgeon was able to point out the particular sinus areas because I had no idea we had so many sinuses. So that was an interesting fact.
I didn't know that either. Yeah.
And that some of those sinuses are non-functioning sinuses, meaning that by altering them, it's not going to alter any functioning with breathing or anything that has to do with any kind of function within your body.
Right.
It's just basically a cavity in the skull that's a sinus. Uh, Who knows why they're there, but I don't. But basically, what they're going to do is, for lack of better phrasing, smash that sinus and create an area where they can basically push the forehead back so that way she gets a more smooth, softer transition between like the forehead area into the brow area.
Right. And we're going to get into that part as well.
Yeah,
There's
that's next too.
that's the next part. So yeah, I don't think my forehead is too bad. It just needs
Yeah.
a little work.
Yeah. And it's also, I think part of it is also moving your hairline down slightly.
Is that what he said he's going to do with
I
my
thought
hairline down?
I
Okay.
thought so.
Is this where is he going to do a coronal instead, like right here?
I don't think we covered that during that one
We need to
group
ask
meeting, but that
because
will be
I
something.
think that's,
Get
yeah, because if he does it, like if he does it back here, that may be a problem. Because I'm like my dad and my mama. I'm kind of loose, like my hair is thin up here.
It's
So
not super thin.
you don't think it's super thin?
No, there's a spot. There's like one little spot over here
Oh.
that is that, but I think that was from like some kind of scar you had.
Right.
And so there's no hair that grows in that one little circular spot. But for the most part, you don't have very much in the way of thinning,
Okay. Well, that's good.
in my opinion.
So, I mean, if they could even do the incision back here,
I don't know
then
how they'd be able to, like, they'd still have, like, in order to like shorten,
they
like
still have
lower
to
your
do it up
hairline,
here.
they'd still have to, get you right here
Right.
and remove
Right.
like a
So
section.
my whole concern is vein. I love my locks, and I'm gonna have to lose some of them. You know, so like I told Egg, what we're gonna do is just gonna have to cut them off before it's time, and we'll cut these like all of these off that are on the
The ones
front.
that are very front.
Right. And we'll save them, wash them, uh, get
And
them ready. And then when all the hair loss from the hair shot, when the hair grows back,
yeah,
then we can reattach it.
Yeah.
We can reattach it through crocheting or interlocking.
Yeah.
Yeah. So
Which
no
I will
problem.
have to learn how to do.
Yeah, you're gonna have to learn how to do crocheting, I think. Interlocking,
I do have some experience with crocheting, just
Yeah.
not hair.
Well, I imagine it's kind of the same thing.
I imagine it's probably pretty similar. Yeah.
No,
Yeah.
no.
It's just a different feeling, different type.
Oh,
I'm
a
sure it's
different type of
a much smaller type of book, so it would be
yeah, it's not the big one.
right.
It's
Yeah, absolutely not.
no.
But it'll be interesting to go through that process.
Okay.
The next one,
Why do you want to take a commercial break?
a commercial break.
Now, pausing for our sponsors.
Wait.
Okay, we're back. Honest Rose,
What?
9, a trans voice.
I was not prepared for that.
Okay, so here we go. We're on the CPT codes. We're still talking about FFS, facial feminization surgery, which I am having on December 11th. The next CPT code is 67900,
All right.
and it is repair brow ptosis or ptosis. I don't know how you say it. It's
If anybody
PT.
out there knows how
Yeah.
to say that, right?
If anybody out there knows how to say it, it's PTOSIS. Ptosis? Ptosis. Okay, Egg, we'll regale our viewers. Our one viewer, which, by the way, you know who that one viewer is?
Please share.
Me.
No, it is not.
Are you sure?
I don't know.
I don't know.
Can you click it? Can you touch it?
No. Okay, let's go.
All right, moving on.
Moving on.
So, brow, I'm going to stick with ptosis.
Yeah, ptosis sounds good.
Is a drooping eyelid. This code is used for procedures that lift the eyebrow, and it specifies the 3 common surgical approaches: superciliary, mid forehead, or coronal. The purpose of the surgery is to improve both the patient's field of vision and facial aesthetics. Go ahead.
So this has less to do with my vision and more to do with the aesthetics. What this is going to do effectively is once the brow bones are smashed, yeah, for lack of a better word, they're gonna smash those bones.
Shave that down.
Shave that down. Yeah, I don't know what exactly they're gonna do. I'm thinking like what is that thing? And a hammer.
Look, a chisel?
A chisel and a hammer. Just a
I don't know
chisel.
that like that. That's terrifying.
Well, I'm gonna be under, so I'm not gonna feel it until the next day. But yes, so the repair brow ptosis, essentially what it's going to do is smooth out this brow area because I have what's I think is a hanging brow and is more masculine. And it's also going to raise the eyelid or the eyelashes up a bit so that it does look more feminine. If you look at Egg's eyelashes, you can tell even though she's plucked them a lot.
My eyelashes? I don't know my eyelashes, man.
These things.
The brows?
Your eyebrows. I'm sorry. Your eyebrows. Yes, not your eyelashes. She doesn't pluck out her eyelashes.
Absolutely not, because I don't have very many to begin with.
You have good eyelashes.
Yeah, because I curled them and put mascara on them.
Oh, okay. Well, no, yeah, that's beside.
Moving on.
Okay.
So brows.
Moving on. Did you read about the brows?
Mm-hmm.
Okay. So now we are on to CPT code 21122.
All right, we're gone.
Rock on. 21122 is genioplasty sliding osteotomies. Thank you, Egg.
I'm pretty sure we're saying that one right.
We're taking a guess at some of these words. I didn't look this one up, so I didn't look up how to say this or how to pronounce this word.
Yeah.
So osteotomies.
Yeah. So
go ahead.
This says genioplasty procedure that involves sliding osteotomies of 2 or more segments of the chin bone, often performed to correct an asymmetrical chin. This procedure involves making multiple cuts to the jawbone to reshape and reposition it, with examples including wedge excisions or bone wedge reversals. So we were told by the surgeon that that this particular procedure would be removing a wedge of the chin to narrow the chin slightly. What we don't know is once they remove that wedge, what are they using, or what is part of the procedure to basically bring the chin together and keep it together?
Right. Right.
So what does that entail?
Because it seemed like he said something about replacing it with some like cartilage or some type of not cartilage, but like plastic piece.
Like so there is a possibility where they take out a wedge, right?
Right.
And then they trim down the wedge they removed, put it back in, but they'd still have to keep it together.
Like how did
but that's what we don't know. We don't know how they're gonna keep everything together while it heals. Like
so
what that entails.
Do we have a pen here? Is there any way you can have you written that down about like the wedge and what we need to know about that? Here.
Well, you've got that last code on that second page. So.
Okay. So this is 21122.
Yeah, that's the genioplasty. Yeah.
Yeah. So what we need to know about that is the wedge, right? How it's being done, how like my chin is going to actually be held together. And that's a strange thing to say, like how my chin is actually going to be held together. But all of this together is strange. You know, if you told me when I was really young that I would be doing this, I would have laughed at you, like putting myself through all of this pain that I've put myself through, just to see myself on the outside and on the inside as the person I am in my mind. So anyway, all that's well and good. Let's move on to
Final code.
the final code that
Drum
we're
roll,
gonna work.
please.
Woo! That sounds like helicopter, right? Okay. So final CPT code is 21030.
Okay.
Excision of benign tumor or cyst of maxilla or zygoma enucleation. Oh, by enucleation and curettage.
Curettage,
Curettage.
I think.
Oh, that sounds good to me.
So, when it serves the maxilla or zygoma, that's upper jaw or cheekbone. And the surgical procedure involves removing the entire tumor or mass by enucleation and scraping away any remaining diseased tissue, which is curettage,
Okay.
to ensure complete removal of the non-cancerous growth.
Okay.
So during the CT, as part of the CT process, they found a small growth that they are going to remove during her series of procedures.
Yes. No.
So that's that one.
Okay. So, hey, can you see a time on there? Like the time in the top corner.
3:33. 333.
333. Okay. Angel codes, bitch. All right. So now that we're done with
The CPT
the
codes.
CPT codes, is there anything that you want to bring up? And I know this is kind of putting you on the spot, but we didn't talk about this, but is there anything you want to discuss in terms of how you're going to feel?
Well, I think as we get closer, I'm gonna feel, more and more anxious around the surgery itself.
As will I.
Yeah, absolutely.
Well,
But I think, yeah.
sorry.
What?
I'm sorry. I have shorts on. Uh, I have Bucky's shorts on too. Bucky the beaver. Is it a beaver?
Yeah.
Okay. I have beaver shorts on my beaver. Go ahead.
Oh my god.
We might have to edit that shit out.
Just more evidence that I can't take her anymore.
We might have to just like edit.
But anyway, wow, not completely lost my train of thought.
Oh,
So
yeah. We were talking about how we were nervous.
right, but I think leading up to the pre-op appointment, it's going to be really critical for us to talk through a lot of things so we can write down questions ahead of time so we can be prepared as possible for that appointment. So we can try to ask all the questions that have come up that we're concerned about.
Right. Right.
And also make sure that we're as mentally prepared as possible.
The mental part is going to be hard.
It's tricky.
The mental part, like you can never be 100 on the mental part because
you just don't. I mean, there's so many variables, and you just never know what's going to happen on the day.
Right.
So yeah, you can, try to consider all the possible scenarios, but there's always going to be like a scenario that you just never considered.
Right.
And not to say that that's what's going to happen, but there's no way of accounting for every possible outcome. But there are ways of preparing yourself for some of the feelings you may have around general outcomes that could happen.
Right.
So why don't, what would you say is your most concerning outcome?
Well, obviously the most concerning outcome is my face, so it would be ruined. I'd look like what I would consider a monster. And of course that necessitates another surgery, a revision.
Mm-hmm.
And let's not get it twisted. A lot of trans women or people who identify on the femme side of the scale and are trans or non-binary, if they're getting this surgery,
Mhm.
there's a lot. What did you say? What was the question? Do you remember? I'm kind of rambling now. I do this all the time, y'all. Listen, this is not anything new. Like, I will start talking and forget completely.
Yeah,
Remember?
same. It was what was your biggest concern, like,
Okay,
in terms of
yeah,
outcome? And
yeah. So
you
let's
basically covered what
Yeah, well,
what
let's not
to
get into
what
it. People get like trans people get it revisions all the time.
yeah.
It's scary because honestly, I don't have that kind of money.
Mhm.
So if I'm gonna have to, if my face gets butchered, then I'm gonna have to live with it for a while and understand that people are gonna stare at me, even more than they stare at me right now. Um, I imagine my psychological makeup will take a dip. Um, oh no, I do have bipolar disorder, so
Right.
that is something that we have to factor in
And monitor
and
closely. Yeah.
monitor, yeah, and prepare for.
Yeah.
Um, yeah, so those things combined, also the pain
Mhm.
in the days and weeks after I wake up from surgery.
Yes.
That'll be mixed with some elation, but like 90% will be pain,
Yeah.
you know. And I've heard and read from many people that the first few days to week or two are the worst, and possibly the worst pain that you will ever experience. Um, Outside of something like natural childbirth. I don't know. Oh no. So the pain aspect is scary. Now they'll be giving me good drugs. Like when I'm in the hospital, to be completely honest, I like IV Dilaudid. I've been in the hospital a lot. I know what kind of drugs I like. Dilaudid knocks me the Dilaudid does for me. If you know what Dilaudid is, you know what it does. So it's great outside the hospital. I mean, inside the hospital. Outside the hospital would be a problem. Would be an addiction issue. But inside the hospital, yeah, I want Dilaudid. And then outside the hospital, I know they're going to give me like Oxys or Roxys or something like that. I've never taken them before. I mean, I took them once, and honestly, I did not like them.
Is that
So
what they gave you after your surgery in Pennsylvania?
yes, yeah, the one that I threw up on.
Yeah, because it was combined with the antibiotic at the
Yes,
time.
yeah.
Like she took, we decided to do both those meds together and had horrible results.
This is in Philly for my bottom surgery, by the
Yeah,
way. No,
yeah.
with
Um,
a surgeon who will not be named. But if you're in Philly and you know anything about trans people who have bottom surgery on the fem spectrum,
you'll likely know.
you'll likely know. Yeah.
Um, but so in the hotel that we were staying at, um, the first like couple doses, we decided that since there was going to be antibiotics and the pain meds that had to be administered on a particular schedule, we decided to do them together at first.
Right.
And like I said, horrible results. She got violently ill and threw up all over her bed, my bed, and my floor. Not my floor, the floor.
The
Um,
floor.
and I think you got my feet too.
Oh yeah.
But anyway,
Did I not get any on you?
just I think just my feet.
Just your feet. Okay.
But and so then it was a mad dash of cleaning up and figuring out what went wrong. We realized that maybe if we were to stagger the dosage of the antibiotic and the pain meds, then maybe we'd get better results. And then that worked. It was just the combination of those two together. That was the issue. So now that we have that experience, we know that in the future, don't take those together.
Right. And so tying that into FFS, there may be, I don't want there to be an infection, but there could be an infection. There could be an abscess. There could be any type of issue. So antibiotics are going to come into play. Um, pain medication is going to come into play. And this all has to be introduced with my psychiatric medicine. I also have Crohn's disease, so it has to be introduced with my medicine for my Crohn's disease. And various other medications that I take day to day. I take about, I don't know, like mostly my psychiatric meds, I take a lot. My Crohn's med, I take one. My estrogen, yeah, can't forget that. Woo woo. Um, but yeah, so it's gonna be a delicate balance. Like how much medication do I take, and how much pain medication do I take? Do I just take pain medication to till I bliss out, or do I try and tough out some of the pain? That answer right now is a big no. That is not going to happen. I am not tough. I've had a lot of pain before, and I don't want it anymore. So while this is pain, it's for a gain, and that's why I'm doing it.
Mhm.
Um, I'm hoping that I will never have to do this again.
Same.
Uh,
It's
uh,
like same.
hopefully this will be my second to last surgery.
Mhm.
Backed up by vocal cord surgery so that I don't sound like this. Maybe I can sound like this. Nah. I do want to sound somewhere in between that though. But yeah, so second to last surgery, I would like for this to be the second to last of the second to last surgeries. I don't want like a second to last part duh, or anything like that. I now 12 to 14 hours is kind of crazy.
Yeah, yeah. I've been contemplating quite a bit on like what that day might be like for me in terms of like
Well, you don't need to be in the hospital for 12 to 14 hours.
right, I understand that part of it. And so I've been trying to think of what am I going to do during that time to kind of occupy myself in a
I know what
way.
you need to do.
I,
You need to
well,
hang out with Bess.
well, there's that, but
Well,
there's also I want to go to walk along the river for a little while.
it's a good idea. That's a great
Because I
idea.
feel like being in that like a nature type setting will help to kind of balance out some of the anxiety and help to relax me a little.
That's a great idea.
So
You know,
that was my old work friend's idea.
that's a great idea.
So so yeah, she brought that up and I was like, I like that idea. So
Well,
I'll be going for a little walk.
yeah, that's a great
Um
idea. I think that's excellent. And while we're talking about walking,
mhm,
we I need to get back to walking again, which means that I need some motivation.
okay.
Uh, and the problem with me and motivation is I get motivated, but I have ADHD, so then my motivation is like floop, and then I go on to something else. I'm
Easily distracted.
easily distracted. I have like 60 tabs open on my browser. Oh my God. Between my three screens, I have like 60 browsers open, and yeah, it's a mess. But that has nothing to do with
Does
FFS.
your brain have that many tabs open at any
It
time?
has more than that right now.
Doesn't surprise.
Yeah, that shouldn't surprise you.
And me, my brain can only have one tab open at a time.
Right.
My processing chip is like from like 1980.
Duh.
Literally.
Uh,
No.
Literally, yes, yes. She just gave her young age away.
Yeah, well,
She is a Bobby.
I am not that young. Okay, I hit perimenopausal phase. It's
Right, right.
not going back.
No,
It's gonna be fine.
not going back.
It's fine not sleeping, really.
It's fine. It's fine having night sweats. Yeah.
Anyway, this is not about me. Sorry.
It is like we've pretty much covered FFS. Like if there's anything else you have in terms of FFS, let's talk. But we can talk about
Well,
anything.
I
Like
mean,
really, I don't think there's anybody on here except for you and me.
but you're going to post this too,
Oh
so
yeah. I'm gonna chop it up. That's why I don't mind.
it's going to be a unexposed eggy salad.
Yeah.
Salad.
Yeah, this is how and this is how I like to do it if we're not in
Make,
separate places.
we're make
Oh my goodness. He doesn't even want to come.
Say hello, puppies. You say hello? Huh? Oh, there you are. It's so cute. This is Nyx.
The notorious
U-G.
NYSPUG.
Yes.
Notorious. Can't too many.
I think as far as this surgery goes, I was when you were doing some of your initial research, I was so just terrified
Right.
of the
Right.
process.
Right.
Because like you said, it's your face.
It is
Whatever is done to it, it's very difficult to hide it. And it's really stressful to kind of like wrap my head around all these different procedures and what it's going to be like after and what the healing process is going to be like, how long that's going to take. You know, I've had to put on, the nurse Eggy hat on several times over the years. But I feel like the intensity is being turned up to like 11 now.
Yeah. Yeah.
So
No, you
it
were.
will in turn. Well, in the 11 was really that first one, but
Yeah.
but
The 11 was
that,
the first one. Okay.
that one was very scary. That will be a topic for another time.
Right. Yeah. We can do
But
that.
but this surgery, it just feels so
Scary.
well, it feels very pivotal, very important, there's just feels like there's a lot more pressure around
There is a lot more
this
pressure.
particular surgery.
Well, because
or series of procedures, but
and I'll tell you why I think so.
Okay.
Because it is not something where I had it scheduled. I mean, no, it is something where I had it scheduled for the surgery that we said we covered first. It was scheduled, but then it became an emergency. Right. This is not necessarily an emergency in the sense where I have to be rushed to the hospital.
Right.
So, this is in that sense, it's the waiting, the waiting for it to happen.
Yeah, all the anticipation around it.
Right.
Absolutely.
The build up, the questions that we have day by day, and the questions that I have, the more I think about it, the more I want to see and talk to my surgeon. But I know I can't take up that much of his time. I know that, normally surgeons do not, you don't you have to consult. You may have one more meeting than you have a pre-op with that set of people. You don't usually talk to the surgeon or at least I've never heard of people talking to their surgeon 4 or 5 times. We've already had one extra time meeting. I assume that since we've paid everything that we can have as many meetings with them as we want. So I don't know.
Certainly going to be plenty of them after that.
Right. Well, yeah. The after schedule of FFS is intensive, but it's for necessary. A good reason. It's necessary. Yeah. And let's talk about the healing process. So I will probably have swollen eyes and will not be able to see for several days after the surgery. I will have, of course, a swollen lip. My nose will be in a splint and I may not be able to breathe out of it for several days. They are going to do the chin work. So the osteotomy? Osteotomy.
You have the pages, I think, over.
Uh, what is this word? Osteotomy?
It's the sliding genioplasty.
Osteotomy. What is that right there?
Yeah.
Okay.
Osteotomies.
Okay. So yeah, the sliding genioplasty, osteotomy, they're going to go through the mouth. So I should have internal stitches and
Be one incision.
it'll be one incision?
That's what he said.
Okay, good. And he seems to think, my surgeon seems to think I'll be able to eat in like a couple days or a week. What do you say?
Well, I think it's more eating like soft solids, not like non crackers type of situation.
I thought I asked him if I could get a steak.
Like, I don't remember that at all.
Right.
But I feel like it'll be soft solids after a couple days, like liquid diet for the first couple days, soft solids for a period of time. After, I'm not sure how long that period of soft solids will be. It'll be a lot of mashed potatoes, Jello, those kinds of.
Right. Well, no, that's good. Let's get the potatoes because I'm ready to eat.
Absolutely. I wonder if you could do something like noodles, because those are pretty soft.
I could do noodles.
But you do have to chew them quite a bit. So maybe
that
would be ideal.
Mashed potatoes, Jello, puddings. Yeah, I'm
sure
yogurt
would be a good one.
Ensures, boosts. Smoothies. Yeah. These are the kind of things that, we're thinking about right now going through that we're going to have in preparation for surgery. These are not things that we can get like after the surgery happens. I mean, we can get some of those things, but we want a stock of them. We want a stock of them, ice packs, bandages, silicone gel, scar scar tape, whatever I'm going to need so that I don't keloid or scar, because my scars usually turn brown, dark because of my melanin. Yeah, as you can see from right here. I don't know if you can see it. Yeah, right there.
Was a simple scratch.
Which was a simple scratch and turned into this nasty piece.
Oh, I think it'll fade over time, though.
No, over time. Look at my tats. But yeah, so I feel like to wrap things up. Well, let's try and talk for 5 more minutes. La di da di da di da. La di da di da di da. Okay, but seriously, there's got to be something you want to say in wrap up of this introduction to.
So I feel like by the culmination of events that have happened up until today related to FFS, I feel much more prepared. I feel more comfortable with the process, understanding more about some of these procedures, having that extra meeting that we had with the surgeon where he shares like the CT and went through and explained a couple of the procedures that we had questions about at the time. Obviously, we have more questions now, but
more than we thought. Yeah.
But I think that particular meeting really helped to calm some of my fears and anxieties around the surgery. I feel like okay, I feel like we can manage this.
Right.
It'll be challenging. There will be a lot of pain, of course.
Poor pain.
You get to take all of that.
Yes. Well, I might visit it upon you, so.
Man.
No, not in a violent way. I am not violent like that, y'all.
No, she is not. But I think I feel good about a lot of the preparation we've done up to this point. exceptionally proud of you for all the work you've put in to
Thank you.
research, make appointments,
Thank you.
have all these discussions, talking about the surgery with me, with the surgeons and the team. And I think I think while we're not 100% prepared,
No.
we're in a good place. We feel like I feel good about what's to come. I feel positive about what your outcome will be. The surgeon
No.
has made me feel more comfortable and confident in what that outcome could be.
No. No.
And I think I had some fears around like you be looking so different that I'd be like,
Right.
this is like a completely different person. Like this is
Right.
like that's gonna be weird for me.
Right.
But the surgeon was able to share some images of some befores and afters of some of his patients, and it was really nice to be able to see those outcomes, and that the fact that like they still looked like them, but they just looked
More feminine.
like a softer, feminized version of.
So
So it was just
what
it was just.
one of the things she's saying is that he's not super aggressive. He's not like
I know you wish there was a little bit like more zhuzh in there.
well, I don't the thing is I don't want to look plasticky. I don't want to look so far away from myself or my family, my
Right.
my blood family.
Right.
That I want to mold in or fit in with my siblings,
Yeah.
so that like people will say, wait, are
They're
you
definitely related,
right,
they're not
right,
like,
right, yeah. So I'm not looking for anything um like model-esque. I feel like whatever I get will make me prettier, and make me look more feminine, and that's the goal. It's not my like I mean, I'm paying a lot of money. Like, don't get it twisted. And they're charging insurance a grip, but the goal is to look more feminine and to have the surgeon be able to do his best on that day.
Yeah. Yeah.
And not botch my face.
Yeah.
The lead up, as you say, is something where I find myself having more questions as we come up to the actual surgery date.
Yeah.
And I want to be able to talk this through with either the surgical team or with the surgeon himself.
Yeah.
Other than that, I do feel confident. I want to thank you particularly because you've been my nurse for a long time now. I've been sick for a long time. I am currently not really sick. I mean, I just got out of a manic episode about 2 months ago, maybe a month. But
Another topic for
another topic for another live.
Stay tuned.
Stay tuned. But I want to thank you for being my nurse. I want to thank you for being my partner. And I want to thank you for definitely sticking by me through all the shitty times.
You're my baby.
You're my baby. So yeah, she's gonna be my nurse. I'm hoping that you get Bestie to hang with you sometime, have them come over here, and help you.
Right.
I'm hoping my blood family comes over, to help as well with either like a food train or some kind of stuff like that. Yeah.
Well, we'll see.
We'll
see
see.
what happens. But I think we'll manage. I know we'll be able to get through this, and whatever. Like, I'm positive about the outcome. I feel good about.
I do feel good about the outcome. I do. I feel like it's gonna go well.
And I think that it's going to be important for us to kind of keep those vibes going.
Yes. Mind over matter, bitches.
So that way only helps to facilitate your healing in a much better
Right.
path, you know.
The
So I just want that to be as smooth as possible. I'm going to do everything within my power to help with that. And I'm happy to do that. And I think it'll just make you stronger, us stronger.
well,
I think I'm excited to see you blossom just that much more.
well, let's hope that happens. The mind is a scary sometimes thing,
Yeah.
and I uh, there is the post surgical dip that may happen.
Yeah.
So we'll have to be ready for that. But other than that, my mind right now going into this surgery is very positive, very full of belief that my surgeon's going to do a good job.
Yeah.
Yeah. So, I mean, really, do you have anything else?
I don't.
Okay.
Not the moment. I mean, I think other things, topics will come up and
Yeah.
will tie
Yeah.
in.
So
Um,
I'm gonna try. Maybe I'll make this a podcast where I will come on weekly, and hopefully Eggy can come on weekly. But if she can't, then we'll get her on every couple weeks or whenever she really feels like it. Yeah, and what I'm going to try and do is kind of do this throughout my um actual surgery. Now, on the day of my surgery, I will go live for a little bit. Um, and then, of course, I'll go under when I get out. I think I'm going to have Egg, if she wants to, go live on Onyx Rose 9, a trans voice, and tell everybody what's going on and maybe take a picture of me, show me like all wrapped up and bandaged looking, swollen and crazy.
Mummified.
Mummified. Yes, 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 yes. So, but yeah, so look forward to the podcast. I don't know what the name of it's going to be, but it's going to be about FFS. There will be also some videos coming about bipolar disorder, Crohn's disease. I'll probably do some writings about that as well. I haven't really felt like writing much. I felt like vlogging or doing live videos more. I do write short form uh, pieces. I haven't written poetry in a minute, so I'll see if I can get back into that. But yeah, check out my spot and thank you very much.
Thanks,
We're going to
all.
end this right now. Bye bye.